All right, my time is showing 1 o'clock p.m. So we will get started so that we can stop this train on time at 2 o'clock. Good afternoon, everyone. Thank you all for joining us today for today's webinar titled COVID-19 Mitigation Strategies in County Jails. These are updates to our previous strategies, which include now testing and vaccinations, contact tracing, information sharing, and discharge planning and decarceration in county jails. Next slide, please, Aaliyah. On today's agenda, we have welcome and opening remarks, which will, of course, start with the Center for Behavioral Health and Justice welcome. We also will unpack a little bit of collaboration and key stakeholders that made a lot of this possible. We'll go into our mitigation strategies and unpack them each individually. We have animated video clips, which I'll talk to you all about later on in this presentation. And then per usual, we have our panel discussion and our Q&A session with Dr. Warsaw, who is an expert in many things, but we love that she is here for us today as a medical doctor. We also have Dr. Elam, the Chief Strategy Officer for the Michigan Public Health Institute. We have Professor Heather Walter McCabe, who is a professor not only in the law school, but also at the School of Social Work at Wayne State University. We have Sheriff Clayton, Sheriff for Washtenaw County Sheriff's Office here in Michigan. And then lastly, we have Dr. Brad Ray, Associate Professor of the School of Social Work, and an expert in all things translational science and research related. And then we'll end with conclusion and closing remarks and have someone from the CDC Foundation also speak and give some closing remarks. Next slide, please, Aaliyah. These slides will be made available to you all sometime after today's webinar. This session will be recorded and we will answer content related questions as we go along, but also at the end of the presentation during that Q&A discussion. There is a Q&A chat box in which you can enter your questions there for the purpose of that session. Lastly, there will be a follow-up survey that should come to you all in a follow-up email. Please, please, please feel free to submit that survey at your earliest convenience upon receiving that. Thank you so much. Next slide, Aaliyah. Here at Wayne State School of Social Work, Center for Behavioral Health and Justice, we envision communities in which research, data, and best practices are used by multiple stakeholders to enhance the optimal well-being of individuals with behavioral health needs who may come into contact with criminal and legal systems. Next slide, Aaliyah. On this slide, collaboration and community of practice key stakeholders, I just actually have to start with saying, wow, because we've had 17,000 engagements, and this includes the number of people who were either reached, informed, contacted for the purpose of these webinar series, but also overall you all accessing the materials on our website, watching the recordings, and even engaging in these live sessions. I want to thank each and every one of you. I also want to send a special thank you to all of our key partners who served as panelists and or presenters within the last year. They are listed here on this slide as well. This work would not have been possible without all of you helping champion it within your respective communities. Thank you. Next slide, please. Again, in regards to the webinars that we have currently available and are on our webpage, are the first 6. So you see December through May, we've had different themes that really unpack layers of the pandemic that were being addressed in that moment. So we have things ranging from, again, those key mitigation strategies, all the way into more specific conversations around jail processes, maybe the vaccinations, communication preparedness, behavioral health, and even decarceration as a strategy. And then again, today in September's Community of Practice event, we'll give a broader update on all of those. Next slide, please. And now I'll pass it to my coworker, Bianca, who will give us the testing and vaccinations updates. Thank you.
Thanks, Tyler. So good afternoon. Again, my name is Bianca Birch. I am a project coordinator here at the Center for Behavioral Health and Justice at Wayne State University. So as shared before during the first Community of Practice webinar, the first strategy discussed in the toolkit was testing. And this strategy still remains fundamental in mitigating the COVID-19 virus, specifically in jail settings. So today I'm going to share some factors to still consider for testing within a jail facility, how to include vaccinations when possible, and share some updates on current testing. So as shared before, there are some variations on how testing is administered, such as available staffing, both jail and health personnel. the surrounding community, and the jail's current COVID-19 rate. So understanding these variations in testing types, listening for current updates, modes of administration, vaccinations, and any updates from other jails and what they have implemented or changed over time can really help you to develop or to revamp your current strategies for your county and what works not only for your staff, but also visitors and those who are booked into the jail. I think it's important to note that the CDC still recommends that to not administer more than one test within a 24-hour period. This still remains the same, even if a person has become or has been moved from one facility to another within that 24-hour period. There's really no need to retest at this time. Next slide, please. So I will try to get through this as quickly as possible. I apologize if I'm a little long-winded here, but there are, I do want to make sure that you get everything here. So there are two types of testing currently available. This will change a little bit in the coming months. And I think, you know, as I'll share a little bit more about that in a minute, but the most widely used is still the diagnostic testing. There are other types of testing that have been used as antibody testing, which is IgG, but I will also get a little bit more into that as we go. So just a little bit about diagnostic tests. Current diagnostic test is still being administered mostly via nasal and throat swab, a little less frequently with the saliva though. Diagnostic tests should still be administered by a health professional. However, home kits are being used more widely and are available to the general public. And they can range in price from anywhere from $20 to $150 in most pharmacies. There is currently an uptick in most areas, and finding a home kit may be hard as they have been sold out. We are getting ready to enter that flu season, so more test kits are being sold at this point. But you can ask your pharmacist to order one, and they should be able to ship one to you directly if you need it. For diagnostic testing, there are still the two types. There is the PCR test and the point of care test or the antigen test. Results from a molecular test can be available within a 24-hour period. However, this does depend on the capacity and the backlog of testing labs that your facility might be working with. So I always say keep that in mind as you continue to implement these strategies within your jail. The antigen or point of care test, this does detect certain proteins on the surface of the virus and is administered via nasal or throat swab. I think it's important to note that while the antigen test is highly accurate for positive cases for COVID-19, negative results are a little less reliable, and you may need to go back and get a molecular test, which is the PRC test. So that still is in play and very current, but establishing or continuing to have a relationship or having a point of care, a point of contact with your local health department can be very helpful to get additional guidance on testing and help in creating or updating strategies for diagnostic test administration in your facility. I think it's another really important point here. Beginning in January of 2020, the CDC does recommend, will probably be implementing more widely a newer COVID-19 test, which is the flu SC2 multiplex. And that screens not only for COVID-19, but that also screens for influenza A and B. The antibody test, as I briefly mentioned earlier, is also referred to as the IgG. And this test is still optional. It is more than likely does not indicate current or active COVID-19 infections. And this is administered by a blood draw and does require a medical professional. So essentially, this test is determining past exposures to COVID-19 by assessing antibody production. It should also be noted that this test does not indicate a current or active infection from the COVID-19 virus. Jails that are only using antibody tests should consult with their local health department to create strategies for administering diagnostic testing if not already done so. For staff testing, this still remains a key factor in mitigation strategies to use for keeping people safe. Continued symptoms and temperature checks within daily work routines should remain ongoing if already implemented within the jail facility. We shared before that jail facilities should have a quarantine plan in place. So even if the staff person is vaccinated, if they have come into contact with anyone who is symptomatic or asymptomatic and has tested positive for the virus, they should receive a diagnostic test here. So based on updated CDC guidelines, it is recommended for staff to home quarantine still for at least a 14-day period as a requirement following exposure to the virus. And then again, it's just to make sure that people keep others around them safe. They should monitor symptoms to make sure that no symptoms have developed or that symptoms have improved within at least a 24-hour post-fever. Fully vaccinated people should get tested 3 to 5 days after exposure, even if they don't have symptoms. And they should continue to wear a mask indoors in a public setting for 14 days following potential exposure or until negative test results. And then based on CDC guidelines, if symptoms do not develop during a 10-day period following their first positive PCR test, and the person does not receive a second positive PCR test result, quarantine restrictions can be lifted. Next slide, please. So there are some key considerations to continue just to keep in mind. And for the sake of time, I'll touch on a few of these. So when considerations on testing procedures within jail facilities are being discussed, input from the jail medical provider or your local health department personnel should be included. It can be helpful to have more than one provider available as a way to increase efficiency and timing for test results. And then when it comes to staff testing, creating flexibility in testing times for staff can help in keeping everyone safe. And then finally, but equally importantly, individuals who have been vaccinated should be tested when exposed to help decrease potential risk or exposure to vulnerable populations. I'm going to pass this on to my colleague, Tyler, and thank you.
Thank you, Bianca. Next slide, please, Aaliyah. Awesome. So before we jump into this next strategy, contact tracing, I wanted to give a shared definition of what that is, just to make sure we're all moving forward in the same space, and to make sure that if, for whatever reason, someone may have not heard this term, they're familiar with it after today's webinar. So contact tracing is a public health tool and process that's used to identify and notify the recent contacts of someone who may have come in contact with an individual who has an infectious illness or a disease. Contact tracing has been used many of times in instances, for example, with HIV and STDs. However, in this instance, of course, we're referring to COVID-19 contact tracing. Next slide, please. Contact tracing should always be done virtually and only in person after all other resources have been exhausted. It is recommended that people with the training and access to social and medical supports for patients conduct contact tracing. So this may be jail personnel, or it may even be partnerships between your local health department or other community agencies to have other personnel assist with this as well. Recommendations also include tracing all contacts from the 48 hours prior to symptoms, again, and in the case of asymptomatic cases, 48 hours prior to testing, similar to what Bianca was just hinting on. This includes anyone that came in contact with the detained individual and were within 6 feet of that person for at least 15 minutes from 48 hours prior to showing those symptoms. And lastly, the objective here is to make sure you're identifying cases or even those locations of cases to break the transmission chain and really disrupt the spread of COVID-19. Next slide, please. Let's quickly recap some of the common symptoms of COVID-19. This may include one, but sometimes a combination of the following. It could be fever, cough, loss of taste, and/or shortness of breath. If someone comes into a jail facility and is released back into the community within the next few days because maybe they posted bail or something along those lines, community contact tracing efforts matter. Like many congregate living facilities, jails are just at high risk for spreading infectious diseases like COVID-19. And this is for different reasons. It may be because of the frequent cycling in and out of the facility. It could also be because of the close living quarters or even sanitation practices or resources available to that specific jail. However, local and state efforts should work collaboratively to mitigate COVID-19 within that facility and the local community. And then regardless of when an individual is booked or released into a jail facility, if they enter that facility with any signs or symptoms of COVID-19, there should be proper protocol and transitional plans in place to allow for the safe transportation of that individual to either quarantine or to jail or community resources where needed. Next slide, please. Some key considerations to think of when implementing contact tracing efforts with your team include collecting COVID-19 related information from the individual at that booking process, at that earliest entry point into the jail. And that allows you to make sure you're collecting all the information needed, especially before that individual is released. You should also partner with local health departments and community agencies. This allows you to even designate an individual within the facility, such as a disease intervention specialist, to help in risk reduction or even implementing further COVID-19 protocols. And then if an individual has been released prior to receiving their test results, you should work with local and state health department teams to contact that individual for follow-up, especially when the resources are available to do so. Next slide, please. And I'll pass this right back to you, Bianca. Thank you.
Thanks, Tyler. So a critical strategy in mitigating the spread of COVID-19 within jail settings and surrounding communities is data collection and information sharing. This continues to be a necessary piece to capture, record, and share information as you've developed your procedures around strategies like testing, vaccinations, and contact tracing as well. So as many of you as may know, data sharing will look different in each jail as it depends on the size, resources, and technology that's available to the jail. So in efforts to implement this strategy, some basic steps should include identifying a person or a small group of people who will be responsible for that daily data collection and management. And these individuals, persons that you may designate might be a disease intervention specialist, as mentioned before. It could be a booking officer, or it might be a medical provider that works closely with individuals as they enter the jail to help gather that information at booking. So ultimately, this information should be shared not only with the jail, but with local and health departments as well. I will note that vaccines are not to be necessarily to be shared with the local community or lab, but I'll get into that a little bit more as we go. Next slide, please. So during that first webinar, I did spend a little time talking about some key points to consider when collecting and sharing data to help drive decisions. Vaccinations will look a bit different in information sharing as each jail implements their own policies and procedures for vaccines. It is recommended that vaccine information is shared as a way to inform and encourage staff and any individuals entering the jail to help increase safety for everyone, which ultimately can include the surrounding community as well. A little bit about testing results. So results from a diagnostic test may occur at varying times based on the established policies within your jail, with guidelines that have been laid out by the CDC and local state governments. Implementation of testing should still be done at entry into the jail and have routine testing of staff when needed. Designated staff, such as a DIS worker or a medical provider, should continue to record the data that's or the data that testing was done. when test was administered, and the date when results were received for each individual. Also, any mitigating circumstances or refusals that prevented testing should continue to be documented. And if possible, recording when information is shared on vaccinations might be helpful as well. Again, it's not mandatory as it is with testing, but just keeping that record maybe for yourself might be helpful. Sharing information with public health. So the inclusion of public health at the state and local levels is important, as they can help in tracking positive cases in any attempt to determine community prevalence and sharing preventative efforts as well. And just remembering that a positive case detected in the jail is not only a cause of concern within the facility, but also it's a public health issue. So this means that individuals in the community have also been potentially exposed as well. Routine practices for sharing information with the health department that should be implemented as an act to connect jail mitigation strategies to the broader public. I think jails have when they know what strategies have worked, they can share that with the broader community just to help, again, keep people safe. Sharing information with detainees and knowing and having a record of your results is always important. It is recommended that jail should share paper copies with all justice involved individuals when possible. So those who have been released prior to receiving a test result, whether it's a positive or negative result, or if it's a diagnostic or antibody test, they should receive notification, and hopefully, that can come from a phone or a text or an email, etc. And then effective communication may help in decreasing individual anxiety and mistrust between the medical professionals and communities. And this is still very true today as we've continued to roll out the vaccine in our communities. So sharing and receiving information involving jail staff. So jails may implement requirements for routine testing of staff and jail admin that may require documentation of that testing. I think it's important to note that that because testing labs are required to report any positive results to the state, the assumption will still be made that contact tracing efforts and a disclosure of the employee will activate prevention and intervention measures within that jail facility as well. Next slide, please. So just as a quick recap of items to consider as key strategies for information sharing and mitigating COVID-19 within your jail, information should be collected for all individuals being detained and booked. Information collection should also include staff testing results when possible. And then identifying a person or people or continuing to do that who will be responsible for the collection and management of all data, I think is essential. Any personnel implementing COVID-19 risk reduction strategies and procedures within the jail, whether that's a public health worker or other designated staff person, should, of course, have computer literacy skills, data management experience, public health knowledge, cultural competency, humility, and have some motivational interviewing skills as well, where possible. And then collection with local and state health departments in efforts to make data-driven decisions. And then finally, sharing information on vaccines, such as where and how individuals can receive one, I think is a benefit to any jail facility. I will go ahead and pass this on to Tyler, and thank you again.
Thank you, Bianca. Next slide, please, Aaliyah. So this is our final mitigation strategy, discharge planning and decarceration. And again, I'd like to share a few definitions before we jump into the actual presentation portion here. Decarceration is the practice of diverting people from incarceration and releasing them from prisons and jails. Discharge planning is the process of identifying and preparing for a detained individual's anticipated needs prior to them leaving that jail facility and re-entering that community. Next slide, please. Ensuring safe transitions from jail facilities into the community requires a systematic and collaborative approach that oftentimes should include not only community resource providers and jail personnel, but also the detainee and their families within that process whenever possible. These discharge plans should be managed remotely, again, whenever possible, to create more flexibility and capacity building for the work that's needed to be done. For example, a larger city jail may have a local behavioral health provider that is oftentimes a little further away from that facility. So convening patients with telehealth opportunities oftentimes saves not only time for travel within both institutions, but it also alludes to potential future cost savings in that space and still provides the patient with the level of attention and the potential care that they require and need. Next slide, please. Some key considerations for discharge planning and decarceration include reviewing your current discharge planning processes and procedures. So this is important because it allows you to see what's currently being done, but also where there may be a need for further additions or some holes or gaps that may need to be filled with other personnel or resources. Creating an alternative method to conduct in-jail provider services, again, is important. So when the pandemic first started, there were a lot of jails that shut down from the outside community, and that included behavioral health providers or other community resources, for example. So pivoting to things such as telehealth or other online services really helps make sure that those resources are still being accessed and are accessible during this time frame. And if possible, utilizing disease intervention specialists or other personnel in that space to facilitate these additional screenings at booking may also be beneficial. There are some jails that are utilizing the disease intervention specialists not only for COVID-19 contact tracing efforts at that entry point in the jail, but they're also using the DIS team as screening for behavioral health, STD, HIV, and other related things upon, again, being entered into that jail or entering the jail as a detained individual. Developing that release plan that informs individuals being released of their COVID-19 test results and community supports and resources is also important. And this is helpful if done with a collaborative team. So working with community providers to establish a process for warm handoffs can also be included here. And ultimately, decarceration requires collaborative efforts from not only jail staff, but community providers and those resources that are available to you all. Before we click next, the animated videos that I mentioned will be coming up. And these animated videos are just a small slice, if you will. Both videos, there are two, and each is just short over 1 minute. Each of the videos target separate populations. There's one video where you'll get a sneak peek of the overall components that we're talking about today, but it's a slither of more so vaccinations for the detained population and unpacks that in conversation. And then the second video is, again, another slither of what we'll see based off of the overall video that will eventually launch next month. And this video is targeting jail leadership, but this trailer, if you will, is more so focused on community resources in the reentry space. So without further ado, Aaliyah, if you could push next and start the first video for us. I don't hear the audio on it. Just a heads up. I think there's a checkbox through Zoom that you select first, and it should start the audio. Let's see. Stacy, can you help us out here? Or share next steps on how to work this out? If we can't, we can also just move on, because we'll if anything, include these trailers in the follow-up email as well, so you all can see that. In the meantime, while my team figures this out, both of these videos, again, will be publicly available on YouTube as well as the Center for Behavioral Health and Justice website. And again, they're geared towards two separate populations, one of the videos being the detained population and the other being jail leadership. However, both videos encompass the mitigation strategies that we've talked about today. In total, one video is about 7 or 8 minutes and the other is about 5-ish minutes. But instead of showing you the combined 15, I figured giving you a smaller clip of each would suffice for now. No problem. You know what? We can go on to the panel discussion for now. And then if we have some time towards the end, we can revisit that. But again, if not, that's okay. We'll make sure that you all have access to that in that follow-up email. So again, today we have our panel of wonderful experts who will engage in dialogue and conversation. Bianca and I will be the facilitators for this conversation. If you haven't already, please feel free to insert questions in the Q&A chat box. We will make sure that we ask as many of those questions as we can. And if we don't get to any of those, we'll make sure that we follow up with you all and respond to those in the follow-up email as well. So my first question I would like to actually ask Dr. Warsaw. There's a lot of conversation right now happening around booster shots. Booster shots for the community, it's sometimes segmented into different populations, but overall, we know that a lot of individuals have received the first vaccinations, maybe 6 months, 7 months, etc. With the current conversations around booster shots, can we unpack that a little bit here today, especially in what that might mean for jails in the future?
Yeah, absolutely. Can you hear me? Hopefully. Okay, good. So the first thing is that there's a difference between a booster shot and a third vaccine. I feel that they're getting, it's very confusing. So just to think about it. So someone who maybe is on chemotherapy or has very advanced AIDS, they never got to the point of protection that you wanted them to get to. And so that's called a third vaccine. So at this point, if there are people in jail or prison who have cancer, are in chemotherapy, there's lots of different things. There is no question in my mind that those people should be getting a third vaccine. That is not a booster shot, that is a third vaccine. And that happens 1 month after their last vaccine. So three vaccines, one, another one 21 to 28 days later, and another one 28 days later. So that is the third vaccine. So pass aside the third vaccine and let's talk about the booster shot. So the booster shot, as of now, is only recommended for people who got Pfizer, which we know was very hard to roll out in jails because of the early freezer requirements. So at least in our jails in Massachusetts, it was very rare that anyone got Pfizer, meaning even the people working in the jail or the people who were incarcerated in the jail. So as of now, based on those recommendations from the CDC, I read it to say that people who are in congregate settings, which clearly include people who are incarcerated or people working in jails, it is recommended that you get another shot. I'm signing up for my shot tomorrow. So I work there as a healthcare worker. I clearly fall into that category. It's only if you had Pfizer, though, at this point that can happen, at least by the FDA. It's important to note that there is research that the third shot doesn't hurt any more than the second shot. I know the second shot hurt a lot, but it didn't hurt more. So when you studied it, it's not like, oh man, the third shot, like people were like keeling over and stuff. So that was not happening. But you should expect from your third shot, you might get the same symptoms that you got for your second shot. So don't plan a big day the next day. And then as far as Moderna goes, I think that will be the next one to come out with the booster recommendations. And then J&J, I think, will also come out with booster recommendations. So I think all of them will have additional shots. Whether or not you determine that you want to get a shot or a third shot, I think there is protection from the 2 shots you got in the first place, or from the J&J, or from the series. You have protection. It elevates your protection. So if you have elderly folk that you live with, or little kids that are not vaccinated yet who are going to school, I can think of those reasons that would push me over if it's recommended to be like, okay, now I really, really want to do this. I really don't want to bring COVID into my home to get potentially people sick, who could get really sick and ill from it. So we know vaccines work. We know vaccines keep people out of the hospital. So hopefully that was what you wanted me to say, Tyler. Or
It was perfect.
Okay,
Almost
cool.
If I wrote it myself.
Okay.
I'll switch over to you, Dr. Elam. In regards to this booster shot conversation, we know that vaccine hesitancy was really a barrier for a lot of the pandemic. And now that we're getting into the booster shot space, what strategies may you suggest people utilize to not only increase vaccine awareness and to get those vaccines in the hands of jails, but also administered, of course? What strategies may you suggest to also include booster shots in that now potential barrier?
Thanks, Tyler. One of the things that we're focusing on is building up the reputation and relationships of what we're calling credible messengers. I think if we're all paying attention to the dialogue and narrative that's going on right now, there appears to be many folks who are providing commentary on guidance around this particular pandemic. And so we tend to start our narrative by saying we are following the guidance, as Bianca mentioned earlier, of public health professionals, as well as for our public health concerns, and medical professionals for our own personal healthcare concerns. And so we are in partnership with federal public health, state public health, local public health, to build strategies to identify credible messengers who can actually provide information similar to what you're doing here on this panel today, because there are multiple perspectives, right? When you look at the federal level, the federal government doesn't even agree. I think Doctor just sort of said the CDC recommended. When you look at the FDA, well, the CDC approved, the FDA recommended, and now you also have the president's office, for example, making comments on certain things. When you get down to the state level, the state might follow the guidance of the CDC, but ultimately we tell folks to listen to your local public health leadership on what needs to take place in your local jurisdiction. COVID and the impacts of COVID vary from place to place, right? And so we can get some general guidance at the national level, but here in Michigan, for example, we're tracking the impact of COVID at the county level and even at the neighborhood level. And so the guidance should be varying based on those local public health and medical professionals. And so I would summarize by saying relationships are key with credible messengers and professionals. And concerning your point around hesitancy, I think we have to focus on reputation. In some of our communities, when we look at health equity issues in the history, some of these organizations have not always led with a reputation where we should consider them credible, particularly for communities of color who might be leading some of the areas of vaccine hesitancy. So some of our strategies also involve how do we address some of those historical reputation concerns that we have in our communities so that we can build the trust and awareness of folks who are choosing not to be engaged in vaccination efforts.
Great, that was a great response, thank you. I'll pivot to you, Bianca.
Excuse me, thanks, Tyler. So I think this is a good question for Sheriff Clayton. I know that lots of jails have begun to or have already implemented, mitigating strategies. So I'm curious, how has your facility mitigated COVID-19, and what lessons learned would you like to share?
Thanks. Can you hear me?
Yes.
Okay. Yeah. So we started right away. One of the first things we did is we engaged, following the lessons that you're talking about, we engaged public health. We wanted to make sure that whatever we did was led by science, and that we kept in mind our obligation to not only keep the incarcerated population and our staff safe, but as you've also mentioned, whatever happens is really a community safety issue. So we followed a couple of things. The first thing is we put in operational protocols that addressed right up front who is coming into our facility. So for our staff, there's daily reporting requirements. They have to report signs and symptoms, and we have the protocols in place if they have been exposed. What processes should they follow? We've implemented testing for both staff and for the incarcerated population. We did a lot of work around education to try to dispel myth, especially in the incarcerated population, because we knew that was what was going on also in the community. So we started to talk about what COVID is, what the appropriate response is, and we had all these things going on publicly around, such as they looked across the nation with people dying and being infected in jails. And we wanted to make sure that people understood that's not happening here. So we did a lot of public facing information. So if you go to our website, you push our tab, it lays everything out, how we define housing. So we put designated housing in place, quarantine. If you come into our jail, we meet you at the door with our medical staff. We evaluate you right there. We give you masks, PPE. We have designated a location where you spend your first 14 days, whether you're symptomatic or not, where we do testing and you have to be negative before you can go in the general population. So we put all of those things in place. We are very sensitive to cleaning anyway, but we really enhanced our cleaning protocols and made sure that we not only provided the resources to the population to clean, but we taught them what we meant by really cleaning and sanitizing the area. So we followed a lot of those things. If we were going to do anything different, we do test. We would have started testing earlier. With the population. The last thing I'll say is, I think it was mentioning, we shut down a lot of the operation of the jail, right? Really trying to manage who came in the jail, but we also understood that impacted people psychologically because now we were disconnecting them from the community. So one of the things we did is we increased televisits and we increased telephone calls because we understood that the psychology of this was as important as the physical nature of how people were responding to the virus.
Thank you, Sheriff Clayton. That was very helpful to hear. Another question I have, and this might be directed more towards either Dr. Worsel or Dr. Elam. What are some best practices for implementing COVID-19 mitigation strategies within jail facilities?
Go right ahead, Doctor. I can follow you if there's additional comments.
That's a big question. I think sometimes there are unintended consequences when you put into place a policy that you may not know, that it actually works against what you're trying to do. So I think the best that you could, if you make a policy, whether it be, who gets quarantined or, it follows the guidelines, meaning the CDC guidelines. Now, granted, with Delta virus, some of the CDC guidelines for corrections might be a little bit out of date, but follows the guidelines. And then you have everyone at the table before to just look it over first, just to look it over, put eyes on it. That'll help you later on. And then you have champions who said, oh, I was at the table. I brought that up as an issue and that's why they changed it. And it really will help you figure out the downstream consequences and how to avoid them. I mean, a big problem is that if people self-identify as having symptoms, then they will be quarantined, which is in a lot of jails very, very bad. So a way to sort of temper that would be in a lot of our jails, we started getting tablets. People could move their belongings to isolation with them. They could be assured that they can get their specific bunk back when they came out of it. Things that to us who have maybe not been in jail seem small are huge, huge in the jail. So I think having everyone at the table to look it over, having, I guess, thick skin, because it means that your idea for the best policy may get destroyed and rewritten. Understanding that don't let the perfect be the enemy of good. There's going to be problems. It's better to get something out there in the first place. I think, and I honestly think it's as much as possible having someone who is incarcerated in the jail to review the policies. I know it's challenging, but is very helpful. It'll help you downstream so much to have someone at the table say, well, that's not going to work because X, Y, and Z. Why don't we do it this way instead? So I think those are the ways to do it.
I would just quickly add, I agree with everything that was said, and going back to what Sheriff Clayton said, follow the science. I think sometimes we just have to be honest with one another and say that we always don't have science to follow, or we don't have recent science. And I think when you think about policy around flying drones, for example, we didn't have a policy to govern how you use a drone in our society, or a policy related to COVID-19 in this contemporary time. And so when we started partnering around this work last March, it was very clear. I'm not sure what Sheriff Clayton is saying now, but working in Wayne County, there weren't a lot of public health professionals working in our jails or our prisons at the time. So we had to come together and partner to build the science, gather the data, begin to share lessons learned, which I think what this panel presentation is all about, so that we could document what effective practice and policy actually is. And so I think the nuance here for me is, when you're encountering something new, what's the best practice to develop new policy to guide our practice and disseminate that so that a critical mass of people can benefit from it. And that's tough work when you have to trailblaze. And I think that's what Wayne State's doing in this particular conversation, and trying to get this work out to the masses of folks who are on the front lines doing this work day in and day out.
Thank you, Dr. Elam and Dr. Warsaw. I'll go ahead and pass this back to Tyler.
Thank you so much, Dr. Elam. I'd also like to pivot that question to Professor Heather Walter McCabe, because I believe you might have some expertise to add to that conversation as well. But if not, let me know and I'll pass on to the next question.
No, I just wanted to thank Dr. Russell and Dr. Elam for what they've just said. And so my background primarily has been in public health law and policy prior to all of this, and through this. And one of the key things that I think both touched on is this idea around collaboration and ensuring that the folks who are going to be impacted by policies are at the table. So often we try to make policies in general, in policy, public health policies specifically, with what we think would be a good idea, and people do so with the best of intents. But if we don't have the people who are going to be impacted by the policies at the table, we run the risk of solving a problem that isn't a problem in the first place, or solving the problem in a way that simply creates more problems. And I think that Dr. Worsel's, am I saying that correctly?
No, but I don't care. It's okay. It's Dr. Worsell, but I'm not going to
Dr. Worsell. I like to say it correctly. Thank you. Dr. Worsell's conversation around having those who are incarcerated at the table is extremely important. And then Dr. Elam's comment about having the fact that there were not too many public health folks already engaged with the prison system or the jail system at the beginning of this. And my hope is that it speaks to ways that we can think about forging some of these partnerships that are ongoing past this pandemic, because certainly a pandemic is something that is really important from a public health perspective. But we've long known that for congregate settings in general, and folks who are incarcerated in particular, there are health issues at the population level that come up. And so the more we can have pre-existing relationships where we don't have to spend time talking about who we can trust and thinking about who we can trust, the better prepared we'll be to jump in when something comes up. And then the last thing that I wanted to bring up was around what several folks have talked about in terms of trusted communicators. Certainly, this has been a huge issue in this pandemic. And in fact, some of the things that we were concerned about prior to vaccines regarding, for example, folks who traditionally had trust of the medical system, reasonably so, not taking vaccines has not necessarily been the case. Often more the case is their ability to access those services. And some places have come up with innovative ways to ensure access, and we're continuing to work on that. And so finding those trusted communicators, particularly when all this misinformation is going out, is really important. And trusting those local folks. When you're looking at which laws govern your particular facility, generally states are the locus of public health laws out of the police powers that exist there. But often states push down to the localities so that things are more responsive to the immediate needs on the ground. So if you're in question, making sure you're talking to the local and state officials, as well as looking at the CDC and federal government guidelines, will be really important when you're determining what the policies for your facility will be. Sorry, that was long-winded, but we'll stop.
No, thank you so much. Thank you. So it sounds like overall, to answer a question that Dr. Elam asked earlier around best practices for developing new policies, collaboration is really big on that. Figuring out who those communicators are of these different policies is really big. I think something that I would love to pass to you, Dr. Ray, is to speak maybe to what happens before that step, right? How do we look at the data and use data to drive those decisions into like translational science, for example? Dr. Ray, can you speak a little bit more to that and to the collaborative piece around it?
Yeah, so I'll just echo what others said here. I mean, this collaboration is one of the big things that we started, talking about when we first started this group, and that is, jails in particular have been a vector point for several major public health crises: HIV, the overdose epidemic, and now COVID. And so part of what we're hoping to accomplish here is for people that have expertise in public health to begin engaging with those systems. And I think that that's a big thing that we've just continued to miss over the years, that people that are public health professionals don't know the difference between a jail and a prison, don't know the difference between a felony and a misdemeanor. And those are important. So I think one thing, in terms of collaboration, it's getting people in public health to the table and have some interest and bring their expertise to this. The other thing I just wanted to touch on that was mentioned is these unintended consequences. And some of these we're just not going to know about for a long time. And I think we're still going to be studying them and examining them for a while, these downstream effects. And I do believe, as was mentioned, having folks that spent time in the facility, it's critical. Like they're going to think of things that, none of us would. And one of the things that we're looking at right now, and I'm not suggesting this happened in Michigan or any place in particular, but as we did this decarceration, as the United States said, we're just going to decarcerate because yes, that is what's safest for the people in these facilities. How were those decisions made on who to decarcerate? How did they make those decisions? We had one event where we talked about using like a case review process. But one of the things we're looking at now is that a lot of the increase in overdose deaths, there's a huge increase in overdose deaths during COVID. And that increase could have been the result in some communities of this mass release, where you have all these people leaving a facility. They don't know where to seek treatment. They don't know that they've identified that they've had a problem. They went out and then they could have had an increased risk of overdose and death. So we're going to be studying those unintended consequences for a while. And it doesn't mean what people did was wrong. Hopefully we can learn from the next time. But I think having people at the table during that case review, having around the discussions of decarceration can mitigate some of those unintended effects.
Thank you for that. For this last question, I'll open it up to you all, and whoever would like to respond, please feel free to do so. What lessons learned would you like to just share for the audience, maybe in a brief 60 seconds or less response, based off of where we were before in the pandemic to where we are now in your respective spaces?
I'll just start out by saying one of the things, big lessons that I've learned that I've taken away from this is, local public health departments need access and need collaboration and need jail data. They need to know who's coming in and out of those facilities. They need to know, because it's a huge vector point for public health problems. So it's something I've been thinking a lot about since this pandemic.
Thank you, Brad. Anyone else on the panel?
I guess I've spent a lot of my time in jail trying to talk to people about getting the vaccine now. I think at this point, it's a one-on-one. It's one-on-one. The messages are out there. People can find whatever they want on their computer. And I think it's just a one-on-one. And every one person, I'm trying to think about every one person that you talk to It could just mean the smallest misconception. It could be 5 minutes. It could mean 40 minutes. You don't know what's going in there. Every person that every time, and we may not get them to the point where they believe us the first time, but we might strike down one fallacy. We might strike down, going into it. And the first thing I always say when I'm in jail trying to convince people to get the vaccine is, I'm not going to force you to take it. I'm not going to force you to take it, right? That's not what I'm going to do. Let's talk about it, because it's almost like telling my kid that they're going to get ice cream no matter what, if they brush their hair or if they don't brush their hair. Usually sometimes they just brush their hair in the end because they, the pressure of the ice cream's off. So I'm not going to force you to take it. Let's just have a talk about it. Let's just discuss it openly. And I think I'm able to do that because I'm a consultant that goes into the jails. And so I think I have some value as a credible messenger that's not necessarily within the institution. And sometimes I can't convince people, and that's okay, because maybe I think if we feel defeated every time we don't convince people, then it's going to push us to not try in the next person. And so I think just do as much as you can, and just have a conversation about it. That's, I guess, what I've learned so far.
Thank you. And we have time before we move on for one more, if there's another panelist who would like to speak out on that. Lessons learned.
Yeah, if I can really quick, I'll just piggyback on what Dr. Wassell just said.
Yeah, please.
That was one of the things that we did, especially with our incarcerated individuals. There was a lot of fear. We heard it. And we weren't trying to force people to get vaccinated, but we did have our medical staff and representatives from public health and our staff just have the conversation. Just give people an opportunity to ask questions, again, to dispel myths. And we saw actually a big increase in participation in terms of the vaccination. And the last thing I'll say is it is evolving, right? So we followed the science that we knew, and we created, there's new science and everything was evolving. As we put policies and operational protocols in place, we never just stood on what we did a year ago. You have to continue to examine what you put in place, the impact of that, if you're getting the outcomes you want, and evolve all of your practices to be reflective to not only current circumstances, but what you can reasonably anticipate is the next challenge.
Thank you for that, Sheriff Clayton. And thank you to all of our panelists for engaging in the conversation today. Next slide, please, Leah. So really briefly, I'll recap and then I'll give the floor to Director Dr. Ray as well as Andrea Malloy from the CDC Foundation. A recap, we do have, again, available webinars for December, January, March, April, and May that are already currently on our webpage as well as on YouTube. Today's September Community of Practice webinar will also be available in the next coming weeks. There will be a follow-up email coming to you all where we'll ask for feedback. So please fill out that survey link as soon as you get it, if possible. And then in addition to everything we've talked about today and up until this point, there is a PDF toolkit, which is a document that is filled with the breakdown of these mitigation strategies, as well as other resources, whether it be examples of contact tracing forms or other tools that either public health or jail staff can use. We will be updating that toolkit, and that will also be shared out with you all and made publicly available in the next coming weeks. Dr. Ray and Andrea, is there anything that you would like to say as we wrap up?
I think Dr. Ray has given the floor to me, so I will just say that I'm honored to speak on behalf of the CDC Foundation, that we have been incredibly honored to be a part of this program. There is not enough work that we are connected to in this space. I work exclusively with the community-driven initiatives, community-based organizations in the COVID-19 response for the CDC Foundation. And this is the only community initiative I've had the privilege to work with that works in the space of justice-involved people, period. So this has really been a milestone, and the most overused phrase and expresses it very accurately in the pandemic is building the plane while flying it. And I have to say that the Center for Behavioral Health and Justice moved astoundingly fast to get that at least the manual for the plane built and out there. So having a toolkit and a webinar and a community of practice has been something that I've heard over and over again from the communities I serve that is the most useful and important thing that we could be bringing to communities across the country, and we can't bring it to them without you. So the communities, and I also want to say the communities have been the ones, the community organizations have been the ones to really make the difference in terms of health equity in this pandemic. Without you, it would have looked very, very different. And I think we all know that. So I guess I'll just close out by saying that I echo what Dr. Ray said earlier about public health involvement in the jail setting. I really, there is going to be a lot of thought and work toward what the recovery looks like as we get there. And I do hope that the lessons have been learned in terms of partnerships, which is everything to us. And I hope our relationship continues so that we do, at the very least, keep this initiative going past the pandemic, keep these partnerships going. The CDC Foundation does what we can to support groups like yours to make that happen and to spread the love throughout the country. So thank you very much.
Thank you so much. And enjoy the rest of your Thursday, everyone. We appreciate it.
Thanks, everybody.